Hi, I'm Margaret. This is Vicki. We're the two nurse
Hello.
practitioners at Icam, and we're talking today about PRP. So, for those of you that don't know what PRP is, it's an acronym that stands for Platelet-Rich Plasma. And why PRP? Because it's a natural alternative to other aesthetics or to steroids that are used for joints or aesthetics for the face. The platelets are part of the blood, and how we get the PRP is that we draw blood and we put the blood in a centrifuge, which separates the blood, and then we obtain the platelets that way. And inside the platelet rich plasma are growth factors, and what the growth factors do is stimulate cellular growth and also release cytokinins, which are a growth factor which causes an anti-inflammatory effect in the body. Growth factors also exhibit functions other than the anti-inflammatory effects. They have bone genesis, wound repair, and can increase collagen synthesis, which is essential for skin and for hair growth. The skin. The outer layer of your skin and the middle layer is the dermis, and that's the primary target with PRP injections. And what that does is it stimulates, as I said before, collagen as well as elastin, which is responsible for the integrity of your skin as well as firmness. I'm handing over to Vicki now.
Hello. When we talk about PRP or platelet-rich plasma, we talk about how it's used as an alternative to synthetic fillers and Botox. We also do synthetic fillers and Botox here at Icam. However, the platelet-rich plasma, the benefit of it is that it's your own cells that we're reintroducing to your body. So there's really very limited downtime and there's very limited side effects. And again, like Margaret indicated earlier, it helps to stimulate the collagen regeneration. We use ozone as an additive into the platelet-rich plasma to activate the platelets in the plasma that we use. And the ozone also has anti-inflammatory properties as well as antimicrobial and antifungal properties. The different ways that we can use the platelet-rich plasma. We can use it as an aesthetic for the face and for the skin integrity. We can also use it for the regeneration of joints and soft tissue as well as bone. We use it for the treatment of acute injuries, including tears and sprains and strains, as well as chronic degeneration, osteoarthritis, degenerative joint disease. And we can also use it for inflammatory disorders such as tendonitis and bursitis. Platelet-rich plasma helps with the skin firming and regeneration. It can help with wound healing, scar reduction, and it can also be used for hair regeneration, increasing your hair count. Platelet-rich plasma, as used for hair regeneration, can actually stimulate the hair growth. It can increase your follicle viability, as well as prevent apoptosis or cell death. It can lengthen your hair growth cycle stage, as well as increase the density of your hair. We do have a before and after photo of platelet-rich plasma for hair regrowth. When you're getting the platelet-rich plasma injections into the scalp, it is done via an injection. So we use a needle and we inject the platelet-rich plasma right into your scalp. Prior to doing that, we would numb your scalp with a topical anesthetic, and then we apply the platelet-rich plasma again, using an injection technique. The recommendation is to have an injection done monthly for 6 months, and then we would reevaluate you, and then the recommendation is to have platelet-rich plasmas injected every 6 months. A couple different ways of receiving the platelet-rich plasma injections. One would be microneedling or dermal epidermal junction needling, and this is used, it's the most superior for targeting fine lines in your face. We can also use that microneedling to treat acne scars or hyperpigmentation of your skin. And that's done using a pen-like apparatus with about 36 needles on the end of the pen. And it stimulates the production of the collagen and the elastin by making injuries into your skin, and as well as trying to get the platelet-rich plasma underneath the dermal layer. We use an intradermal injection as well. The intradermal injections, we actually inject using a needle on your face. We inject the platelet-rich plasma. Prior to that, we would give you again a topical anesthetic so that you don't feel the needles. This helps to target the structural proteins, the collagen, and it's great for superficial deep lines in your face. And then there's another technique we use, it's called subcutaneous, using your the platelet plasma. What we do is we actually warm it up by heating the plasma up. We make a filler type gel, and we use that gel to inject into deeper lines, maybe around your mouth or right around the nose area. We can even inject it into your lips as well, give you a plump, full lips. And all of these techniques help to stimulate the collagen production, reducing the signs of aging. Here's another example or another picture of before and after of the microneedling. Microneedling has very little downtime. You are instructed to not wear makeup for about 24 to 72 hours after the microneedling process. You might have a little bit of redness associated with it, but the redness goes away within that 72 hours. We can use platelet-rich plasma and give you joint injections. The wonderful thing or the best benefit about this is that very minimal side effects when you're comparing it to a steroid injection or surgery. It's much longer lasting, and it's natural and it's organic because it's from your own body, it's your own cells. It speeds and promotes the healing, and there's very minimal to no downtime. We can use these platelet-rich plasma joint injections to anywhere in your body, your shoulders, your elbows, your hips, wrists, hands, knees, ankles, feet. And that wraps up our little talk about platelet-rich plasma. If you have any questions, please feel free to contact us, myself, Vicki, or Margaret, one of the nurse practitioners here at Icam.
Thank you.